Hello, and welcome to the introductory video on using the Focus Builder app. We believe Focus Builder to be the most versatile and customizable eye movement training app on the market today. It is an app for doctors and clinicians alike, and it gives them the ability to prescribe both home and in-clinic exercises to patients to enhance their neurological rehab. As such, I'm therefore reminded of the following quote. The power and utility of any tool is proportional to the knowledge, expertise, and reasoning ability behind its use. So along that theme, it's important that the doctor prescribing the exercise fulfill these three requirements to make most effective use of using Focus Builder. One, you want to have a fluency and understanding of the muscles that move the eye. Two, you want to have a fluency and understanding of the eye movement systems, of which there are 6. And 3, you want to have knowledge of the neural substrates that serve both the first and second points, including the cortical and subcortical areas of the brain involved in moving the eyes and in vision. So armed with these requirements, Focus Builder can be an extremely effective tool and will allow you to train all 12 muscles of the eyes in an almost infinite number of customizable ways. It will also allow you to rehabilitate all 6 movement systems of the eye. And it will also promote positive plasticity in those neural structures which support, again, number 1 and number 2. All for the end goal of creating a greater awareness for yourself and your environment for your patients and improving both brain function and their ability to fovealize in their environment. So to demonstrate, what I'm going to do is break down one of our more popular and common exercises that we use. And I'm going to use a software program from 3D Medical called the Eye Series, the Practical Eye Series. And what I'm going to do is I'm going to actually draw out the muscles and the substrates that you are using in this one particular exercise. And the name of this exercise is actually, they're called Carrick brain exercises, developed by Dr. Carrick, but they're also known as collicular mapping exercises. And I'm going to do the one exercise, which is a combination of saccades and pursuits that will target the left cortical structures, left midbrain structures, and right cerebellar structures. So the exercise itself involves a pursuit that starts in the upper right corner. So I'm going to draw this as if you are seeing it from the patient's perspective. So the eyeball with the muscles that you see here, I'm going to note as the right eye and left eye. So it's going to be as if the patient is doing the exercise. So it is a diagonal pursuit going from the upper right to the lower left, which is followed by microsaccades, which are what we would refer to as gap or express saccades, that go from the lower left to the upper right. So let's take the first, and then I'm just going to divide the brain into right and left as well, because we're going to look at the neural substrates. So when we are doing a pursuit in this upper right to lower left diagonal direction, the muscles we are going to use is this one up top here. I'm going to put an arrow right to it. This is the right superior oblique muscle. And we are also going to be using the left inferior rectus muscle. Now, the nuclei for each of those two muscles both sit on the left side of the midbrain. As you know, it's cranial nerve 3 and cranial nerve 4. Cranial nerve 3 sits in the rostral portion or upper portion of the mesencephalon or midbrain on the left side. And then we have cranial nerve 4, which is just below that is the innervation for the superior oblique, and then cranial nerve 3 is the innervation nuclei that innervates the inferior rectus. So we're staying on the same side of the midbrain here, and by doing this pursuit, we also engage the left cortical side, cortical portion, specifically the parietal lobe, of course. And in order to track a smooth pursuit, we're going to also be utilizing the cerebellum on the right side, which has a relationship to the left mesencephalon or left midbrain, as well as hardwired relationship to the left cortex. So that's the pursuit. So as you can see, we consistently are targeting this left side, activating it by doing that pursuit portion. Now, the muscles that we use when we go from the lower left saccades up to the upper right are this muscle down here, which is the inferior oblique, which is, as you know, innervated by cranial nerve 3 on the left side. And then this muscle right here, which I'm just marking out here, the superior rectus. And the nuclei, or nucleus of the superior rectus, also sits in cranial nerve 3 on the left side in the left midbrain. And the frontal eye fields in the left cortex are responsible for sending instructions to the left superior rectus, firing the eyes, fast eye movements or saccades to the right side. So as you can see, this specific combination of pursuit and saccades is very good at targeting left side brain structures, which has a relationship with the right cerebellum. So that's one of many that you can do, but I thought I'd show how neurologically you can do targeted exercises to help your patients improve certain areas of the brain by evoking potentials on that particular side of the brain. Thank you very much.